Hello everyone, and welcome back to Molar Academy. Today, we're continuing our series with a topic that every dentist must understand, not just for exams, but for real-life clinical safety. Hypertension. Imagine this. A patient walks into your clinic for a simple extraction. They look completely fine, no complaints, no symptoms. But their blood pressure is dangerously high, and you're the first one to notice it. So, what is hypertension? Hypertension is a chronic elevation of arterial blood pressure, and it's strongly associated with serious conditions like stroke, myocardial infarction, heart failure, chronic kidney disease, retinopathy. So, while it may seem like just numbers, it has life-threatening consequences. According to the World Health Organization, a staggering 1.28 billion adults aged 30 to 79 suffer from hypertension. Can you believe that 46% of these individuals are unaware they have it? Even more concerning, only 21% have it under control. Hypertension is responsible for approximately 10 million deaths globally each year, making it a leading contributor to stroke, ischemic heart disease, and about 50% of cardiovascular deaths. You might be wondering, why the term silent killer? Most of the time, hypertension doesn't present any symptoms. This allows it to progress quietly yet dangerously. And sometimes, the first presentation is a stroke or heart attack. Why should dentists care? As dentists, we're not just treating teeth, we're treating patients with systemic conditions. Sometimes, you might be the first healthcare professional to suspect undiagnosed hypertension. And interestingly, hypertension and its medications can show up in the mouth. You might see gingival bleeding, periodontal disease, delayed wound healing, and due to medications like diuretics, which can cause xerostomia, calcium channel blockers, which can cause gingival hyperplasia, ACE inhibitors, which can cause angioedema and a burning mouth syndrome, beta blockers, which can cause altered taste. So next time you see unexplained oral findings, think beyond the oral cavity. Common risk factors include family history, stress, age, obesity, unhealthy diet, alcohol, tobacco use, high cholesterol, simple but powerful contributors. How do we diagnose it? Here's the key point. You cannot feel hypertension. You measure it. The American Heart Association states that the only way to confirm hypertension is through measuring blood pressure. A health professional will typically take an average of 2 or more readings on multiple occasions to reach a diagnosis. Now, this is the part you must remember, because this is what you'll actually use in the clinic. Blood pressure levels for clinical decisions. It's normal when systolic is less than 120 and diastolic is less than 80 millimeters of mercury. It's elevated when systolic is 120 to 129, and diastolic is less than 80 millimeters of mercury. Stage 1 hypertension is when systolic pressure is 130 to 139, or diastolic pressure is 80 to 89 millimeters of mercury. Stage 2 hypertension is when systolic pressure is greater than or equal to 140, or diastolic pressure is greater than or equal to 90 millimeters of mercury. Hypertensive crisis is when systolic pressure is greater than or equal to 180 and/or diastolic pressure is greater than or equal to 120 millimeters of mercury. Important. If it's a hypertensive crisis with no symptoms, then refer to a physician immediately. If symptoms are present, call emergency services immediately. Let's quickly outline the types of hypertension. Primary, also called essential. Most common type, no known cause, multifactorial, genetics, diet, obesity. Secondary hypertension, less common, has a known cause, renal, endocrine, or drug-induced. White coat hypertension occurs due to anxiety in clinical settings, causing a temporary elevation in blood pressure. Your role is to calm and reassure the patient. Before moving ahead, remember this. Managing a hypertensive patient is not just about avoiding complications. Every dental visit is a potential cardiovascular stress test. So, how will you manage a hypertensive patient? As I always say in my lectures, the first step is medical history. Ask about duration of hypertension, medications, history of stroke or heart disease, compliance. Then, check vitals before treatment. Classify the patient based on BP. Decision-making. Blood pressure more than 160/100 leads to defer elective treatment. Blood pressure 180/110 or more. Defer and refer immediately. This is where great clinicians stand out. Anxiety reduction protocol. Short morning appointments, calm environment, good communication. Anesthesia tip: limit epinephrine to 0.04 milligrams because it increases BP. During treatment, continuously monitor for signs and symptoms. After treatment, give proper post-op instructions. Emphasize medication compliance. Ensure follow-up. Now let's talk about hypertensive crisis. A rapid increase in blood pressure can lead to life-threatening organ damage. If you ever experience it in a dental setting, remember SPCABD. Stop the procedure and remove the instruments from the patient. Alert your staff and activate emergency medical services. Position the patient upright or semi-supine. Assess vitals, especially BP, every 5 to 10 minutes. Make sure the airway is not obstructed and the patient is breathing normally. Give oxygen only if needed. Document everything. Do not rapidly lower BP. This can cause stroke. Stabilization is the priority. If chest pain is present, then consider nitroglycerin, only if trained and indicated. Here are some important things to remember. If hypertension is controlled, you can use limited epinephrine, 0.04 milligrams, not more than that. If uncontrolled, it's better to avoid treatment if possible, and avoid epinephrine if you must proceed. Never aggressively lower BP in the clinic. So next time a patient sits in your chair, remember, you're not just a dentist, you might be the one who prevents a medical emergency. I hope this lecture made hypertension clearer, more practical, and easier to remember. If you found this helpful, share it with your friends, and don't forget to like and subscribe to Molar Academy.